we're going to move on now to two video presentations. Unfortunately, our next two presenters have teaching commitments and can't be with us. But if you have any questions, I think their contact details are going to be in the presentation, so send them in. And the first one we're going to go to is Dr. Paul Comfort, who is going to be talking about resistance training for health and how progressive overload is essential, but rarely appropriately applied.
Hi, I'm Paul Comfort. I'm the Programme Leader for the Master's Degree in Strength and Conditioning at the University of Salford and the Research Theme Lead for the Sport and Exercise Science Research Group. Unfortunately, I'm teaching all day today, so I can't be there to present this in person, so I've had to pre-record it, but apologies for that. Okay, so we're going to look at resistance training for health with a real focus on progressive overload and a little bit of a discussion about the fact that it's rarely appropriately applied in practice or in research outside of the applied strength and conditioning world. So the aims of this session are to look at progressive overload and explain what progressive overload is, to explore the strength continuum, and to discuss how progressive overload should be applied in a health context. And part of the problem is, if you look at the picture on the top, people think of strength training as looking like that, large muscular people lifting very heavy loads. However, if you look at the picture at the bottom, this can be strength training. If this individual can only perform 4 or 5 repetitions of a sit to stand comfortably without becoming fatigued or without additional assistance, that's strength training. So, progressive overload, what is it? Well, it's not a new concept. It was discussed by Delorme in the 1940s and 50s, but actually goes right the way back to Roman and Greek times. There's Milo of Crotona, which this figure is based upon, where he had to pick up a calf from his dad's field and move it into the next field each day. And as the calf grew by a few hundred grams each day, and as Milo grew, by the time he had a fully grown bull weighing over 2.5 tons, the myth is that he could still pick up and carry the bull. Clearly that's not feasible, but that's what progressive overload is, a progressive increase in the intensity or the volume of exercise that you perform. However, there is a problem if you just keep adding volume. So part of the problem we've got within a lot of the research, especially in the health context, is that it hasn't progressed a huge amount in terms of the exercise-based interventions that are used, and sometimes for good reason, since the 1940s. And sometimes suboptimal methods of increasing strength, power, etc. are used. Back in 1945, Delorme actually stated that the attempt made to restore power by exercises to build endurance is a big mistake. And it is, because they're completely different. The different force production characteristics and qualities required for muscular endurance and strength and power are all intertwined, but they are unique in themselves. So if we look back at what Delorme was doing back in 1945, we can clearly see here you've got a single joint knee extension type exercise, and you can see that the weight's attached to the bottom of the foot. So it's a normal knee extension, but you can see on the right hand side a whole range of different weights and loads that can be added, with the key emphasis here of progressive overload from adding load once the person can complete 3 sets of 10 repetitions using this set load. The first set you'd normally complete 10, then it may be a few less. And if we look at some other exercise alternatives, so multi-joint exercise, so actually loading a step up, you don't really need a device like is shown here on the left hand side. You could just put some weights in a rucksack or make the person hold a dumbbell. For some people, body weight alone is enough to start with, and then you may be able to add a weighted vest, etc. On the right hand side, you can clearly see this person doing some press-ups on some parallel bars, but actually if you look closely on their back, they've actually got a device to allow them to attach additional load. So again, to create progressive overload once a sufficient number of repetitions can be performed. And that's important because if we just keep adding repetitions, you start training a different strength quality. If we look in 1948, Delorme was performing similar sort of research, applying progressive overload in a similar way 3 sets of 10 repetitions, 3 exercises, and progressively increasing load when required. And when required is once you can perform all 10 repetitions in all 3 sets with good technique comfortably. Then you just add the next increment of load. You'll probably get 10 repetitions for the first set, and then it will slowly decrease across the consecutive sets. So back in 1948, Delorme found in males and females that had suffered loss of muscle mass and loss of strength through a range of different etiologies that actually this noticeably and significantly increased muscle mass. And his study in 1950 also showed that muscle mass of World War II soldiers who'd lost significant mass and function through the quadriceps due to injuries, and that's a whole range of different injuries, normally leading to femoral fractures. They could have been falls, bullet wounds, etc. That this had provided huge improvements in their function. Now the problem is, if we just keep adding repetitions and we don't increase load, you end up moving along this strength continuum. And if we just keep adding load and staying at the same repetition range, we stay in the same point that we're on the strength continuum. So if we look at this continuum, we've actually got for strength endurance, which also includes muscle hypertrophy, so the focus on increasing muscle mass, loads of 65% of maximum load, 1 repetition maximum or less for 12 repetitions or more. Then if we look at the range that Delorme was working in, 8 to 12 repetitions, so 3 sets of 10 in the case of Delorme. Here's the focus on hypertrophy. And then if we look at general strength, 3 to 6 repetitions, much higher loads, now 80 to 90% of 1 repetition maximum, and moving on to maximal strength, which you probably don't need in most clinical populations. But this works across a continuum. You will emphasize maximal force production with higher loads and lower repetition ranges. You will emphasize muscular endurance more down at the lower loads and the lower repetition ranges. But actually for most individuals, once they suffer muscle wastage, you need some hypertrophy, and then you need to move up and progress onto that phase of general strength up towards the maximal strength range. We've got the foundations of increasing force and strength once you've gone through a hypertrophy phase, and then we need to progress on that little bit further to some higher loads. And there's numerous studies showing that adaptations to strength training are very, very specific. If we want to increase maximal force, we need to use higher loads. If we want maximal velocity, we need lighter loads at higher velocities. If we want muscular endurance, we need lower loads and higher repetition ranges. And in contrast to what most people think, power output or maximal power output actually occurs somewhere between about 70 and 90% of 1 repetition maximum. So if we train at those loads for people that aren't already strong, which probably none of the general population would be classed as strong, and certainly no clinical populations, you get more or greater increases in power from general strength training than you do from muscular endurance training. At the same time, this is also more likely to cause increases in bone mineral density, etc. So there are some issues. This is rarely applied. You look at most training interventions and they stick around a set repetition range, or they stick with a set load. They don't progress from one aspect of the strength continuum into the next to give us those other adaptations, and that can also cause monotony and stagnation of your improvements in performance, stagnation of adaptations. But the monotony is a problem. Adherence rates drop off and people don't continue with that type of exercise. So we need to vary it slightly. And there's lots of simple ways of doing that. And it's not always increasing load. It can be going from a bilateral squat to a split squat to a unilateral squat, if the person is strong enough to perform some of those tasks. So why do most interventions work? Well, they create progressive overload. You look at most of the studies and you have no exercise compared to some exercise. So it doesn't matter whether that's walking, whether that's body weight resistance exercise, light resistance bands, therabands and tubing. That's created some overload. So it's more than the person's system is used to doing, especially if they've been in a hospital bed or they've suffered some muscle wastage. So it will create an adaptive response, but only for a certain amount of time. Then we need to add overload. We need to adhere to that theory of progressive overload to allow continued adaptations. And that can't happen if you just stick with a TheraBand. we need additional resistance. And then at the same time, if we're only training in that hypertrophy range, the 8 to 12 repetition range, we need to progress up to the more strength-based range. And that's pretty simple to do. For some people, as I said right at the beginning, if you can only do a sit to stand 4 or 5 times, that's real strength training. That's a very high intensity load for that individual relative to their capacity. So we've got to make sure we stick within this sort of continuum, ideally starting off in that sort of hypertrophy range, because most people, if they've lost function in mass, they need to focus on regaining that muscle mass first, and overcoming that loss of muscle size. And then once we've got those foundations and we've got some extra muscle mass there, we can focus on the neurological adaptations of trying to get that extra muscle to generate force more efficiently and more effectively, which comes optimally or more effectively from higher load training. So there are huge benefits to strength training for musculoskeletal health, and there's a whole range of different things that it can benefit. Along with aerobic training, we can actually help improve the outcomes of cancer patients, people with depression, people with tendon injuries, losses of bone mineral density, osteoporosis, osteopenia, etc. So there's a whole range of different things that we can use this for, and that research has shown it's effective for. But the majority of studies don't apply this principle of progressive overload appropriately. So there's a huge gap in this research field. And in this systematic review that we published recently, we concluded that strength training confers unique benefits to the musculoskeletal system for most common disorders and in healthy people as a preventative measure. But the application of mechanical loading must be specific to obtain the desired positive adaptation. And by specific, that doesn't mean it has to look like the movement you're trying to train. That means if you're trying to train strength, we need a high load. If we're trying to train hypertrophy, the volume is higher, because the adaptive response to resistance training, if we're aiming for hypertrophy, comes from the volume of exercise. So there's huge benefits, but we need to make sure that this is actually performed correctly and that progressive overload is used in its most effective manner. So hopefully that gave you a whistle-stop tour of progressive overload and the strength continuum. If you've got any questions, please feel free to email me, paulcomfort at p.comfort@salford.ac.uk, and I'll answer whatever questions I can as quickly as I can. And if you want to discuss any interventions you're planning on using and whether you could progress them more efficiently or more effectively, I'm more than happy to answer those questions.
Yeah, that's great. So thank you very much indeed to Paul for that. That was interesting stuff.